What if your U.S. visa could be denied? Not because of missing paperwork, not because of background issues, but because of your health. That's exactly what many applicants are now worried about after new reports suggest that chronic illnesses could become a silent deal breaker in upcoming U.S. immigration screenings. Now, before you panic, let's break this down clearly, because there's a lot of confusion and misinformation spreading online. First, this isn't an official ban. The U.S. government hasn't released any blanket rule that rejects people with medical conditions. But here's where the twist comes in. Recent updates to medical inadmissibility reviews mean consular officers and USGCS doctors now have more authority to question or delay visa approvals when long-term health conditions could affect an applicant's ability to support themselves financially in the United States. In simpler words, if an applicant is seen as likely to depend on public health resources, they could face extra scrutiny or even denial. That's why applicants with chronic illnesses like diabetes, heart disease, or autoimmune conditions are now under sharper review. Now, here's something many people don't realize. This doesn't automatically disqualify you, but it does mean the supporting medical and financial documents you submit are more important than ever. So if you're applying under a work visa, student visa, or family petition, and you have an ongoing medical condition, the U.S. consulate wants to know one thing. Can you sustain yourself without becoming a public charge? That's the real question behind this entire update. Immigration isn't just about travel. It's about proving you can stand strong in a new system. In the next part, we'll explore the hidden factors that can raise red flags even when your paperwork looks perfect. Let's talk about those hidden red flags that could quietly hurt your U.S. visa case, even if your documents seem flawless. Most applicants focus on their financial papers and job letters, but immigration officers look deeper than that. They're trained to notice patterns, and sometimes your medical disclosures or even the way you answer one small question can change everything. For example, if you mention ongoing treatment but forget to attach proof of medical coverage, it raises a concern. They might assume your condition could cause heavy expenses once you're in the U.S. Here's the thing, the officer doesn't want to deny you. They're trying to assess whether your move could create a dependency on public assistance, and that's where many cases go wrong. If you have a chronic condition, show that you have a treatment plan, private insurance, savings, or a sponsor ready to help. Those details matter more now than ever. Remember, medical inadmissibility isn't about your illness. It's about your preparedness. The U.S. system just wants to see that you won't be left struggling without support. But there's another twist people often overlook. Even if your medical side looks perfect, inconsistencies in your affidavit of support can trigger extra screening. That's when your sponsor's documents, tax returns, and even income stability come into play. So here's the key. The more complete your story, the easier the process becomes. When all your medical, financial, and personal information align perfectly, the officer sees confidence and responsibility, not risk. In the next part, we'll go over real examples of visa cases that faced medical-related delays and what they did to fix them. These lessons could literally save your application. Let's look at a few real examples that show how medical factors can quietly delay or complicate U.S. visa applications. Take the case of a student from India applying for an F-1 visa. She had a chronic thyroid condition, completely under control with daily medication. During her interview, she mentioned it casually, thinking honesty was always best. But when asked to show proof of ongoing treatment or insurance, she didn't have documentation ready. Her visa was placed on administrative hold for additional medical review, a process that lasted nearly 6 weeks. Once she provided medical records from her doctor and proof of private health insurance, her visa was approved. The delay wasn't about the illness. It was about missing support evidence. Now consider another example. A man applying for a family-based green card who had diabetes. His lab report showed consistent treatment, but his financial sponsor's affidavit was weak. USGCS issued a request for evidence, asking for proof that medical costs wouldn't become a public burden. The man's sponsor later submitted proof of stable income and private insurance coverage, and the case was approved shortly after. What do both of these cases teach us? Preparation matters more than perfection. You don't have to hide your condition. You just have to show that you've planned for it responsibly. Think of it this way. The U.S. isn't rejecting people for being sick. It's screening for sustainability. Can you live, work, and stay healthy in the U.S. without depending on federal aid? That's the real test. In the next part, we'll talk about which medical conditions draw the most scrutiny and what you can do to reduce your risk before your medical exam or interview. So, which health conditions actually raise red flags during U.S. visa processing? Let's break that down clearly. Not every illness is considered risky, but conditions that could affect long-term self-sufficiency or public safety are given closer attention. For example, contagious diseases that could impact others, like active tuberculosis, are reviewed very strictly. The same goes for severe mental health issues that might pose a risk of harm if untreated. Then there are chronic conditions like diabetes, heart disease, or kidney problems. These don't automatically disqualify you, but they can make the medical officer look deeper into your financial stability. The concern is not the illness itself, it's whether ongoing treatment will create dependency. If your medical history includes regular treatment, you should bring full documentation, doctor's letters, prescriptions, proof of insurance, and recent lab reports. The more transparent you are, the easier it is for officers to clear your case. And here's something many people overlook. Lifestyle matters too. If your medical form mentions smoking, obesity, or other preventable risk factors, it might trigger follow-up questions. These aren't automatic denials, but they do raise curiosity about how well you'll manage your health once in the United States. In short, the medical exam isn't just about checking boxes. It's about assessing your readiness for life in a new country, physically, financially, and mentally. In the next part, we'll explore how to prepare for your immigration medical exam step by step so you don't get caught off guard by surprise, questions, or missing documents. Now let's talk about how to prepare for your immigration medical exam so you can avoid any unexpected issues or delays. First, understand that this exam isn't like a regular doctor's visit. It's a formal process conducted by a panel physician authorized by the U.S. Embassy or by a civil surgeon approved by UCS if you're already inside the country. Before your appointment, gather all your essential records, your vaccination history, prescriptions, and any documentation related to ongoing treatments or chronic conditions. Bring everything neatly organized and easy to explain. Next, make sure your medical information is consistent with what you wrote on your visa application forms. Even small differences, like medication names, diagnosis dates, or doctor details, can trigger extra verification. Consistency builds credibility. If you're managing a long-term illness, bring a letter from your treating physician explaining your condition, treatment plan, and how it's under control. This helps the immigration doctor understand that you're stable and responsible. Now, here's an insider tip. Honesty matters, but oversharing can hurt you. Be truthful, but focus on facts, not fears. You don't need to go into emotional detail. Just explain your condition and show that it's being managed well. During the medical exam, the doctor may check your vaccinations, review your history, run basic lab tests, and perform a physical exam. For some cases, additional testing may be required depending on your medical background. When you finish, the doctor will seal your medical results. Don't open them. Send them directly to USCIS or bring them to your interview as instructed. In the next part, we'll go through what happens if your medical exam uncovers something unexpected and how to respond without losing your visa opportunity. So what happens if your immigration medical exam reveals something unexpected? Don't panic. If a condition that needs more information, they'll usually request additional tests or medical documents. For example, if a chest x-ray shows something unclear, you may be asked to provide older medical records or undergo another test to confirm you're healthy enough to travel. In most cases, this is just a routine check for public health concerns, not an automatic rejection. The key is cooperation. Respond quickly, follow every instruction, and keep all your medical proofs updated. Delays often happen because applicants wait too long to submit follow-up results. Now, if your condition is considered manageable and you've shown that you can cover your treatment, Whether through private insurance, personal savings, or a sponsor, your application will likely move forward without issue. However, if the illness is severe or contagious, like active tuberculosis or untreated mental health conditions that could pose safety risks, the visa officer may delay or temporarily refuse your case until treatment is completed. And here's something you should know. U.S. immigration authorities aren't looking for reasons to reject people. They're looking for assurance that newcomers can live safely and independently. That's why every step you take to prove stability helps your chances. In the next part, we'll go deeper into what the public charge rule really means in medical situations and how it can impact your visa even when your health looks fine on paper. Let's talk about the public charge rule. One of the most misunderstood parts of U.S. immigration law, especially when it comes to medical conditions. The phrase "a public charge" basically means someone who might rely heavily on government support after arriving in the United States. It doesn't just apply to money. It can also include health and long-term care. Here's how it connects to your visa. If a consular officer or USCIS officer believes your medical condition could prevent you from working, studying, or living independently, they might flag your case under the public charge rule. This doesn't mean denial is automatic. It simply means they'll look more closely at your financial background, your income, assets, sponsor support, and access to health care. If you can clearly show that you have coverage or support, your application remains strong. For example, showing proof of private insurance or savings can make a huge difference. Even a letter from your sponsor confirming they're aware of your condition and can assist, if needed, builds trust and transparency. Here's an important reminder. Being open and well documented is your greatest strength. Trying to hide a condition can backfire if discovered later. Honesty combined with preparation shows that you're reliable and ready for the responsibilities of living in the U.S. In the next part, we'll go over how officers actually review your case behind the scenes, what they look for in medical and financial forms, and what small mistakes can raise doubts without you even realizing it. So how do officers actually review your case behind the scenes? Let's pull back the curtain a little. When you submit your medical exam, financial forms, and visa application, everything is cross-checked for consistency. Officers compare your answers, medical summaries, and sponsor documents side by side to look for any contradictions. For instance, if your visa form says you have a stable job offer, but your medical report mentions limited workability, that raises a red flag. Or if your sponsor's affidavit promises full support, but their income doesn't meet the required threshold, the officer may pause your case. Every detail you provide helps build a story, either one of readiness or of risk. The clearer and more organized your documents are, the easier it is for the officer to see that you're prepared and genuine. They're also trained to notice tone and attitude. Applicants who stay calm, answer confidently, and provide records without hesitation create a positive impression. Nervousness is natural, but being defensive or uncertain can cause unnecessary suspicion. Another common issue, missing vaccination proof or outdated lab tests. These small oversights can cause delays because officers can't finalize a case until every medical requirement is satisfied. If you ever receive a request for evidence, also called an RFE, don't panic. It's not a rejection. It's simply the system asking for more clarity. Provide what they request, stay polite, and meet the deadline. In the next part, we'll discuss what types of evidence can strengthen your case. Documents that help show you're not just medically fit, but also financially and emotionally ready to thrive in the United States. Let's talk about the types of evidence that can truly strengthen your case and make your immigration file stand out in a positive way. Think of your application as your personal story. Every document adds a new chapter that shows you're prepared, stable, and ready for life in the United States. Start with your medical evidence. If you have a chronic condition, provide recent test results, your doctor's notes, and a letter confirming your treatment plan. Make sure these records clearly state that your condition is under control and that you're fit for travel. Next, move to financial documentation. Bank statements, insurance papers, or income proofs that demonstrate you can manage your healthcare independently are very powerful. If a sponsor is supporting you, their affidavit of support should include recent tax returns, job verification, and proof of income stability. Also, consider adding personal preparation details. For example, mention if you've already arranged health insurance or if your employer offers medical coverage. Even small things like these can help show that you've planned your move responsibly. If you're applying through a work or student visa, attach any letters that confirm your ability to maintain financial and medical stability, such as scholarships, job contracts, or employer benefits. The more evidence you provide, the less guesswork the officer has to do. So, a complete file tells them one simple message: you're not a risk. You're ready. In the next part, we'll go over common myths about medical denials and the real truth behind what actually causes a visa refusal. Now let's clear up some of the most common myths about medical denials in U.S. immigration cases, because a lot of fear online comes from misinformation. Myth number 1, having any chronic illness means automatic rejection. That's false. The U.S. immigration system doesn't deny visas just because you're managing a health condition. What matters is whether your condition is under control and whether you can take care of yourself without depending on public funds. Myth number 2, you can hide your illness if it's not visible. That's a serious mistake. Your medical exam is thorough and panel physicians are required to report all relevant findings. If USCIS or the embassy later discovers missing or false information, it can lead to denial or even a long-term ban. Transparency always works better than concealment. Myth number 3, if the doctor finds something unexpected, you're immediately refused. Not true. Most of the time, you'll be asked for additional reports or treatment proof. Many applicants with conditions like asthma, diabetes, or high blood pressure get approved once they provide evidence that their situation is well managed. Myth number 4, you can't appeal or fix a medical refusal. That's also wrong. In many cases, if you can prove recovery or improved health, you can reapply or submit new medical results later. The system allows room for correction. So the truth is simple: preparation, honesty, and proper documentation matter far more than fear. In the next part, we'll go over what kinds of health insurance coverage or financial evidence can make your application nearly rejection-proof, even if you have a chronic condition. Let's talk about one of the strongest tools you have for securing approval: health insurance and financial preparedness. If you can prove that you have reliable healthcare coverage before entering the United States, it immediately strengthens your visa case. It shows immigration officers that you won't become dependent on public medical services, which directly addresses their biggest concern. For employment or student visas, you can usually show your employers the university's health plan. Bring official letters or policy documents confirming that you'll be covered once you arrive. If you're applying through a family-based visa, private insurance, or travel medical insurance is your best option. Even short-term coverage during your first few months in the U.S. can make a difference. It proves that you've planned ahead and can manage any emergency without relying on government aid. Savings can also play a huge role. Showing proof of funds for medical or living expenses, like bank statements or fixed deposits, creates a sense of financial stability. Immigration officers prefer seeing applicants who are not only medically fit but financially secure. And here's something many overlook: a sponsor's letter that specifically mentions awareness of your condition and willingness to assist adds a layer of credibility. It reassures the officer that there's a support system in place if needed. So if you're managing a chronic illness or ongoing treatment, strong insurance and financial documentation can turn potential risk into approval confidence. In the next part, we'll discuss how upcoming policy shifts and global health trends could influence future medical screening standards for immigration, and what you can start doing now to stay prepared. Now, let's look ahead, because immigration rules are always evolving and global health trends are starting to influence how medical screenings are handled. Over the past few years, U.S. immigration authorities have become more cautious about public health risks, especially after global events like the pandemic. This means stricter verification of vaccination records, recent medical tests, and travel history. Future updates may include digital health declarations or more detailed medical data sharing between countries. That's why keeping your medical records organized and up to date will save you a lot of stress later. For example, travelers from countries with higher rates of infectious diseases may face more frequent screening even if they appear healthy. Having vaccination proof and clean medical certificates ready can make your interview much smoother. It's also expected that chronic illnesses will continue to be evaluated through a financial lens, not as a moral judgment, but as a sustainability check. Immigration officials want to know if you can manage your treatment independently without relying on government programs. To stay ahead of these changes, focus on three things. Keep your vaccinations current, have recent medical test results available, and always carry updated insurance proof when applying or renewing a visa. Being proactive instead of reactive is what sets successful applicants apart. In the next part, we'll go through the most recent consulate updates from key regions and what new trends officers have started emphasizing in 2025 medical-related interviews. Let's go over the most recent updates from U.S. consulates around the world and what they've started emphasizing in medical-related visa interviews for 2025. In Asia, particularly in India and the Philippines, officers have begun paying closer attention to applicants' medical forms. They now ask more follow-up questions about long-term medication use, treatment consistency, and insurance coverage. This isn't meant to intimidate. It's part of a broader move to ensure transparency and readiness. In parts of Africa, applicants are being asked to submit vaccination records earlier in the process. Missing or outdated vaccine proof has become a top reason for administrative delays. So, if you're applying from Nigeria, Kenya, or Ghana, make sure your health records are current and clearly translated if needed. For applicants in Latin America, consular officers are focusing more on sponsor credibility. They want to confirm that the sponsor truly understands the applicant's medical situation and is prepared to assist if required. A simple letter confirming awareness of your health status can go a long way. And in Europe and Canada, the medical screening process has become more digitalized. Results are now uploaded directly to immigration databases, making it easier for officers to verify authenticity and spot inconsistencies instantly. The pattern is clear. Across every region, health and financial preparedness are now deeply connected. It's no longer just about meeting medical standards, it's about proving you're ready for independent living. In the next part, we'll talk about how to prepare for a consulate interview when you know health questions are likely, including how to answer them confidently without over-explaining or sounding uncertain. Let's close with one of the most important moments in your immigration process. The consulate interview. If you know health-related questions are likely, your goal is to show calm confidence and clarity. The officer isn't there to judge you. They're simply assessing whether you're ready and capable of living independently in the United States. When asked about your medical history, be brief but factual. Mention your condition only if it's relevant and immediately follow it with reassurance. For example, you might say, "Yes, I have diabetes, but it's well controlled with daily medication, and I have private insurance coverage." That one clear sentence tells the officer everything they need to know. Avoid long, emotional explanations. They can sound uncertain. Stick to facts and show that you've prepared. Keep copies of your doctor's letters, recent reports, and proof of insurance neatly organized. Small details like these make a big difference in how your case is viewed. Also, maintain positive body language. Smile gently, make eye contact, and answer confidently. Consular officers can sense sincerity. They want to approve applicants who come across as responsible and self-sufficient. Finally, remember this: your health doesn't define your eligibility, your preparation does. Many applicants with medical conditions successfully move to the U.S. every single day because they demonstrate control, planning, and independence. So take this as your checklist: honesty, documentation, and calm communication. Combine these three and you'll stand among the strongest applicants this year. Thank you for staying informed with immigration updates. If this helped you, make sure to follow for more clear, verified updates that help you move one step closer to your American dream.